and welcome to LA Currents. I'm Saida Pagan. It's called Project Roomkey, and the goal is to provide secure hotel rooms for at-risk people who are also experiencing homelessness during the coronavirus pandemic. Heidi Marston is the Interim Executive Director of the Los Angeles Homeless Services Authority, and she joins us now to shed some light on how it's working. Welcome to our program.
Thank you.
Your agency, which is also known as LAHSA, is running the program here in the Los Angeles area. Tell us a little bit about your agency.
LAHSA is a joint powers authority between the city and the county, and we are the entity that is charged with our county's response to homelessness. So prior to COVID and even post-COVID, looking at what does our long-term recovery need to look like.
What's the idea behind Project Roomkey?
Project Roomkey is an initiative that was started by Governor Newsom, and the idea is to partner with hotels and motels across the state who might have vacancies in a time like this where there's many safe-at-home orders and businesses are closing down, to use those hotels as shelter for our populations of folks who are experiencing homelessness and need a place to shelter so that they don't contract coronavirus.
Now, how exactly would this program help slow the spread of coronavirus?
We know that our individuals who experience homelessness are among the most vulnerable populations that we have, and the safest thing we can do to stop the spread of coronavirus is to be inside, self-isolate, and limit our exposure to others. If you're experiencing homelessness, you don't necessarily have the opportunity to do that. So providing this shelter that are individual rooms for folks makes sure that they're inside, that they're not coming into contact with other individuals, and that, again, their risk overall is being lowered of contracting and then further spreading the virus.
Now, how did you get the word out to the hotel and motel owners, first of all? How did the word get out?
Yeah, that was an initiative led by the state initially, and LA County partnered with the state to send a big notice to all hotels and motels statewide. And then we really dug in deeper on the county level and the city of LA level to engage one-on-one with these hotel and motel owners to encourage them to participate, explaining what the program is and why it's beneficial for everybody involved.
And what has been the response thus far?
It's been phenomenal. We've seen some amazing opportunities with hotels really stepping up to do the right thing. Not only is it an opportunity for our population to get indoors, but it's also a chance for hotels and motels to keep their doors open, keep their staff employed, and get payments for rooms that would otherwise be vacant. So it's really a win-win.
And who is eligible?
So we are targeting folks based on the CDC guidance of what is vulnerable, meaning you're either over the age of 65 or you have a chronic underlying medical condition where if you were to contract COVID-19, you would likely become hospitalized and potentially pass away. So it's not only an effort to keep folks safe from contracting it, but also a method to prevent inflow to our hospitals so that we can maintain capacity in our hospital system by protecting this population and keeping them isolated.
One thing I was wondering about as I was researching this is how do you verify that these individuals are the age that they say they are and that they have these chronic conditions? How is that verified?
A lot of it is self-certification. We trust the individuals, and also LAHSA, this is not the first time we've engaged with these individuals. We have very robust outreach teams that are out there day and night throughout the entire year. So oftentimes we already have the information for these individuals captured in our data systems. We know who we're targeting, and if they're reporting that they have these medical conditions, we're taking that and we're putting them inside for their safety.
And how are people referred to Project Roomkey?
There are a variety of ways that folks can be referred. One way is through our outreach teams who are out doing work with these folks every day. So we're identifying people who not only are eligible, but who want to go inside. So there's a mechanism for our outreach workers to refer. We also have a very large network of nonprofit service providers who have the capability to refer through our system as well, who are working with folks coming into their shelters or their access centers across the county. We have partners like Department of Mental Health at the county or Department of Health Services that also have the capability to refer people in through our centralized referral. So it's a very broad pool of who can be referred. We know that in LA County we have at least 15,000 people experiencing homelessness who are eligible, and that might be a low estimate. So we're really focused on getting as many of them indoors as we can.
And that 15,000 represents approximately what percentage of the homeless?
We have about 58,000 people who are experiencing homelessness. So it's a small percentage, but it's certainly impactful. That's a lot of people.
Right, it's sizable
Yeah.
that could benefit from this program. Now, so you basically answered this, but no one can just walk up to the hotel and get a room, right? What would you do?
That's right. So we are trying to keep the names, locations of hotels confidential for a number of reasons. One is walk-ups are discouraged because there is a referral process because of the way the program's structured, because we want to minimize contact with individuals and ensure we're not spreading the virus unnecessarily. So there's a referral process we go through, and then we do everything that we can to keep the hotels contained and making sure that we're checking people as they're coming in and out to keep them safe and minimizing that interaction.
Right, let's talk about that. So once they have been approved to go into one of these hotels, walk us through step by step what happens to that individual. What procedures does that individual have to follow?
So generally, we're filling hotels. If we have a new hotel, for example, and say it has 50 rooms available, we'll do an opening day and we'll bring in probably 15 to 20 people who are on that list. So they are transported there through our outreach teams, maybe through a Lyft or an Uber, and they arrive on site. And the first thing we do is help them get all of their things together. We do a medical screening, so we take their temperature. We have nursing staff that's checking for symptoms. We want to make sure everybody coming in is healthy as they're coming in and not exhibiting symptoms. And then they start working with our case management teams and our providers. So we help them get situated in their room. We give them the mask and the appropriate personal protective equipment to make sure they can stay safe, go through the rules, and really enroll them in the hotel like you would check in at any hotel. It's the same process with the exception of having that added medical component for everyone's safety.
Now, I understand these individuals are allowed to leave for essential duties or whatever else they need to do. So how can you ensure that they don't contract coronavirus while they're there? What procedures do you have? What steps do you have?
So you're right. The whole goal of this is to provide people an opportunity to be safer at home and to have a place to self-isolate. So while we don't lock the doors, we don't force people to stay inside, we are encouraging them to stay. So part of what we do is deliver 3 meals a day to people's doors to make sure that they don't have any reason to come out and get food. And we do as much as we can in terms of interaction on site at the hotel. If folks do have to leave for whatever reason, say they have a job or other things, we have nursing staff on site throughout the day. So anybody who comes and goes is checked for symptoms before they come back to the property. And that's not just the people staying there, it's also all of our staff who are staying there. If you think about it, really our staff are the ones that are interacting with more people. They go home and they come back. So their risk and their possibility of bringing the virus in is much greater than people who are isolating at the hotel. So we're checking everybody.
And what would happen if an individual does contract coronavirus?
If an occupant does contract symptoms, we follow the Department of Public Health protocols. So there's a referral line that we call to see should they be going to the hospital, should they be going to a medical isolation or quarantine site to be tested. Both have happened. So there have been cases where somebody develops a fever, for example, and we transfer them to another site that has medical staff on site, that has testing on site, and that is built specifically for people who are either symptomatic or positive for COVID-19, and they stay there for the duration of their symptoms.
Now, I know a lot of people are a little bit confused because there are two sets of hotels and motels. There is another program for those individuals who actually have coronavirus. Can you tell us a little bit about, I believe they're called medical sheltering sites?
That's right. There are 2 types. One is Project Roomkey that targets people who are not sick. And the idea is really think prevention. So we don't want them to get sick, so we're isolating them. The other are the medical sheltering sites that are for people who are either symptomatic and are being tested and are waiting for their results, and they don't have the capability to shelter in their home for whatever reason. And then they're also for folks who are positive for COVID-19 but don't need to be hospitalized. So we keep them in a specific area so that there is minimal risk of them spreading the virus outside of that.
And these hotels could be in the same part of town, but they're just designated as one or the other.
Right. We separate them so that there's no interaction between the two.
Now, you were talking about the different services. So let's hone in and let's talk about the different services that they receive while they're at the hotel. And we're talking now about the Project Roomkey.
Yeah, so Project Roomkey has a wealth of services. The first thing is the support staff on site that are nonprofit homeless service providers who really have experience working with this population, and they know what needs to be done to make sure that people are getting what they need. In addition, as I mentioned, we have nursing staff who are on site 12 hours a day to monitor symptoms. We have 24/7 security on site for everybody's safety. We do tell our guests that they are not allowed to have visitors because, again, this is only for people who need to shelter. So security helps us to monitor that. And then we have the food delivery service 3 times a day that comes to their doors to do that. In addition to this, though, we've really thought creatively about how can we partner with some of our county agencies, our legal service partners, LA Family Housing, the Salvation Army, Volunteers of America, people assisting the homeless, to use this moment where everybody's inside to talk with them, to see what is it going to take to get you indoors, what do you need, and how can we help. So we're working on a partnership with DMV to get IDs issued to folks in Project Roomkey. Our legal service partners are helping with record clearing and tickets that have piled up and oftentimes become a barrier for people to get indoors. And we also have our Department of Public and Social Services, making sure people are getting SSI benefits or their CalFresh benefits if they're eligible. So we want this moment for them to walk away with everything that they're eligible for to set them up for success moving forward.
And what are they allowed to do? Read, watch TV? Can you walk us through
Anything that we would do in a hotel. We don't monitor what they do in their rooms. Some folks, and boredom is a real thing. If you were in a hotel room for a month or two by yourself, you could get bored. So we definitely try to work with them on getting access to a Netflix or a Hulu or movies. We have a wonderful team of folks who are creating welcome kits for everybody, so they get a bag with puzzles and games and drawing pads and things like that. So anything we can do to help fight the boredom, we're trying to make that happen.
Have you spoken to some of the people who've been, tell us some stories about people that you've met who I'm assuming are very grateful.
Absolutely. And this is more than just a shelter. We have shelter already built up across Los Angeles County, but it's in a congregate setting. So this is really the first time that we have shelter where we're not only bringing you indoors, but you have your own bathroom, you have your own TV, you have your own bed, and you don't have to worry about neighbors. And that's really healing for a lot of people. Just being able to come in and get rest is meaning more to folks than we could ever imagine. Some folks are thrilled. I remember one gentleman in particular, he just couldn't believe it when he walked into his room and he found a robe hanging in the closet, and he said, I get a robe? And helping these folks see, you deserve this, and you deserve a dignified space to be. It's really, really just rewarding to see their reactions. And even if you look at these folks over time, getting a good night's sleep can't be understated, and seeing their ability and their desire to come out and engage and talk to our case managers and think about what their long-term plans are, this is helping to facilitate that because it's taking the stress of the streets off of them and providing them with that safe space.
I know what you're talking about because a few months ago I did a story about individuals who were unhoused and were able to get a shower, and how grateful they were to be able to shower because it had been a really long time. So now, how long can people stay at these hotels or motels?
So there is no duration other than the term of the lease. So generally the hotels and motels have leases right now that go through the end of June. Some go a little bit beyond that. So we're not telling folks they need to leave before then unless they want to, or hopefully they get some sort of housing solution that facilitates them moving on to something permanent. But there is no requirement for how long or how short a period of time.
Okay, so bring us up to date on the program. How many rooms are filled? Are you up to capacity?
We have 32 hotels that are open across the county. We have just over 3,000 people in those rooms. We hit the 3,000 benchmark yesterday, which was huge for us. And then we have about 200 or 300 rooms that are open because over this past week, we have opened new sites. And so every time we open sites, we get another 100 rooms or 200 rooms that become available. What we're finding, though, is as we open a site, we're filling it in 3 to 5 days, and it's staying full. There really isn't the type of turnover that you see in some of our other shelters because people want to be there. It's a safe place, it's quiet, they can do what they want to do. So it's been very successful in motivating folks to stay inside. And frankly, these folks, just like everybody else, they're scared. They're scared for their health. They're scared for their neighbors' health who are also experiencing homelessness. So it's a great opportunity, and folks are eager to stay indoors. The numbers are incredible, and it's due in big part to things like Measure H that our voters passed a few years back that has given us the capacity to step in a really big way. Because of Measure H and the infusion of resources, we were able to build up our providers much more. So when the time has come now for Roomkey, they're ready to pivot and they have staff ready to deploy, and we can move this really big system quickly. But they're incredible, and none of this could be done without our very broad service provider community.
Are you hoping that more hotels and motels come on board?
Absolutely. We want to keep partnering. We need to make sure that the funding pieces are in place so we can afford to keep this going. But as long as the resources are continuing to come from the federal government, we're going to keep going and making this happen.
Yeah, let's talk about funding. So how is all of this funded?
So it's a variety of funding. The biggest chunk of it, though, comes from FEMA, who's going to reimburse up to 75% of the costs of the hotels, the leases, and the operations. So we're banking on that, and our ability to extend depends on FEMA extending the authority for us to go longer. The state has also provided emergency funding to the city, to the county, and to LAHSA for COVID-19. So all of the funding that we've received from the state for that purpose is also being dedicated to Project Roomkey, and we're funding the services up front.
Are there other states doing something similar?
You know, I haven't heard of many other states doing this. I think California is kind of thinking outside the box here and leading the way. And hopefully people will see that this is an optimal solution. But when I talk to some of my colleagues who work in the natural disaster space, they have said this is not something that they tend to see in a disaster. So I'm really proud of California for stepping forward and thinking creatively here.
Absolutely. Now let's talk about the meals. Who provides them?
So we have a provider, they're called Every Table, and they provide 3 meals a day to all of our residents on site. They're hot meals for dinner. Lunch varies, sometimes hot, sometimes cold, and then a breakfast meal. So we have a wide variety for vegetarians or for special dietary restrictions, but it's been an excellent partnership in making sure that folks have nutritious meals.
Absolutely. What is the approximate cost per occupant? I know it would vary, but approximately.
Well, it depends on the room price. So we're trying to stay within $85 to $100 per room. So it kind of depends on the negotiations with the hotel. But I would say it's about $120 or so a day per person with all the services that come online. And of course, there's a range on that.
Let's talk about people in the neighborhood. What has been the response of residents? I know it's varied from place to place, so walk us through the gamut.
Yeah, I would say broadly, folks are excited. Folks are willing, they're happy this is going on. Not only is it getting their unhoused neighbors indoors, but it's also providing business to their local hotels and motels. So in that sense, people really understand it and appreciate that. Of course, there are some neighborhoods that are not as welcoming, who either just don't understand what we're trying to do and don't support it for whatever reason. But in those cases, we work really hard with those community leaders to help them see why this is the best approach, not just for the folks who are going in, but for the community as a whole. The fewer people that are outdoors and are exposed to each other, the less opportunity there is for COVID-19 to spread.
By the way, are people from the surrounding areas put in particular hotels, or can they be taken across town?
It depends on what the person wants. Generally, people want to be in a hotel where they're living or near where their encampments or they're staying. So we do try to facilitate that. Los Angeles County is broken up into 8 service planning areas. We call them spas, and that's kind of our universal language. So we try to keep folks within their service planning area and not cross borders when possible, unless there's cases where people really need to go to another part of town. We also, of course, try to fill the hotels with people from that community. In a place like, Venice or Santa Monica, we have a lot of folks who are experiencing homelessness downtown. So we want to pull from the streets there so folks are staying in that area.
Now, what about people who are part of a family that is homeless? What happens if you have a partner or a children or whatever else? How would you handle that?
You're also allowed to stay. So we actually have a lot of folks who were staying together outside in a tent, or who are a couple or a family, and we can move them in as a unit. As long as one of the two are eligible or one member of the family is eligible, we put them all in.
So they would be in the same room or adjoining rooms, or how would that work?
It depends on the size of the family unit. If there's 2 people, we would put them in the same room. If it's a larger unit, we would try to accommodate that too.
Well, let's talk a little bit about the economic impact of hotels and motels participating in this program.
Yeah.
I would think it would be a boost to the economy. So let's talk a little bit about that.
Absolutely. Travel is down, tourism is down, and hotels. A lot of the hotels we've partnered with had actually closed their doors and said we can't stay functioning right now. So this has not only given them an opportunity to open their doors, but it's given the housekeeping staff opportunities. It's given their concierge staff opportunities to come back to work. In a couple of cases even, we've partnered with their kitchens to get their chefs back to work, and the chefs are providing food to the people who are staying at the hotel. So it really is a win-win for them to have that continued revenue, and it's a guarantee on their hotel that their rooms are going to be filled. So in that sense, it makes good business sense.
I'm sure you're thinking down the road about how you possibly could use these hotels and motels as a resource for bridge housing. Mm-hmm. Tell us your thoughts about that.
Yeah, we need capacity, we need space, and this is an excellent opportunity for hotels who want to partner in that way. The governor has laid that out as one of his priorities, is thinking about how do we do long-term partnerships with these hotels, and we want to try to maintain this capacity as much as we can. What we don't want is for this program to end and for people to go back to the street. So we're really focused on making sure that if we can't extend leases, that folks have a place to go, whether it's interim housing or permanent, hopefully permanent. We want to create exit plans for everybody so they remain safe.
Let's talk about the leases. Now, most of them are 90 days?
About 90 to 120 days, depending on when they started. Mm-hmm.
So that's how most of it works.
Yeah.
Well, tell us your personal opinion about how this, it's been what, 3 months now? 2 months?
2 months, yeah.
What do you think of it?
I'm thrilled. First of all, I'm so proud of our system. I think we've treated homelessness as a crisis for a long time, but it's been hard to always maintain the momentum, the funding streams, the public will, the political will to keep that going. This has brought a new surge of energy to our work and really helped us to double down. And what it showed us is that we can move much faster than we ever realized that we could. To say that in 6 weeks or 7 weeks that this has been open, we have now sheltered 3,000 people. That's half of all of our interim housing inventory almost. And so we know how to do this. And what I want to see is that it demonstrates to the entities that fund us, to the policymakers that work with us, that if you resource this in the right way and you let us move forward with interventions that we know work like this, we can make a marked difference in homelessness in Los Angeles County. We just have to think really big and really bold, but it's possible.
What are other community and political leaders telling you? What kind of feedback are you getting from everyone?
It's across the board. We have some communities who were opposed, and when we engage with them and we say, why don't you come over to the site? Why don't you talk to some of the folks who are staying there? And they engage with some of the clients. They walk away and they're now our biggest supporters of the program because they see the human aspect of this. We have other communities who are saying, how can we volunteer? How can we help support this community to make sure they're our neighbors, and we really want to embrace them. Others are still slowly coming along and still have their concerns that we're working with, but this has really been a countywide effort from LAHSA to LA County Fire to the sheriff to all of our health services to make this happen and to be as successful as it has been.
Have you heard anything from political leaders?
Absolutely. We know here in LA City alone, our city council members are really embracing the sites that are in their districts. They want to be a part of it. They want to, not only have they engaged with the sites that are opening, but they've even stepped out and said, who are the hotel owners that I can call in my district and ask them to do this? So their willingness to step in, I've been so proud of our political leadership in this moment.
And approximately how many more hotels and motels would you need to come on board to deal with this program to the extent that it should be dealt with?
Well, we're going to keep going as fast as we can until we're told to stop. We know the need is 15,000, so 3,000 is fantastic, but there's still a long way to go. And so really it's a race against the clock right now to make sure that we're moving as quickly as possible, not only to create capacity, but to move people through. You know, if we have a room and we can take the person in that room and house them permanently, that room opens up for somebody else. So it's kind of a both and, building new capacity, but also creating the throughput so that we can create capacity within the inventory that we have already.
Do you feel this program is helping out with other needs in the community in any way?
Oh, absolutely. I think that it's obviously it's getting people back to work. It's helping to tell the story of the folks that you've seen for a long time who are on your sidewalks and understanding who they are from a human place with their stories. It's 3,000 people, it's 3,000 stories, 3,000 experiences that have been brought in. And this is life-changing for those folks. And they're a key part of our community, and I don't think that can be overlooked.
So do you feel that it really has brought out a sense of humanity?
Absolutely. There's the pandemic, as horrible as it is and as devastating as it is, it has shown us that we can do this, we can mobilize, and we can treat these folks with the respect and the dignity that they deserve, and make a dent in homelessness in Los Angeles County.
Now, if people want to find out more information, where do they go?
They can go to lahsa.org. To see more. We have all of our resources on our website. We have videos and testimonials if you want to learn more just about the program itself, lahsa.org.
And what's in these videos? What kinds of stories are being told in the videos?
It's a variety. Some are folks who have moved in. And you know, another big piece of it that folks forget about is a lot of our unhoused neighbors have pets. Most of our hotels are letting them bring their pets with them, and so getting their pets inside, and now I have vet services that I can connect them to, and so it's those types of stories. It's really the heartwarming things that you want to see and how this effort is making a difference in the lives of these people.
And you mentioned the various services, the various service providers who come in, specifically about finding housing. Could you go over that a little bit more in depth about finding these individuals housing? What's the goal and how many people come in, or who deals with this issue?
Yeah, so LAHSA is working on that with our service providers. So we are working with folks to get housing applications ready. It really depends what the person wants. Some people just need a subsidy to pay partial rent because they have income. So we want to connect with them and during this help them find units that they want to apply to live in. Other folks need more supportive housing that has more wraparound services. So we're trying to facilitate that. We're also seeing a good number of people who are really, really sick. We knew they were sick, but getting you inside, getting the stress moved away so we can really see how vulnerable and sick you are, is showing us these folks need nursing care. They need assisted living care. So it's really helping us to see the vulnerability and help place them in the intervention that's going to be the best suited for that person.
Are some of the individuals so sick that they really need to be moved out to a hospital or somewhere else?
Yes, yeah. Some of these folks are really, and we see that a lot actually when folks are coming. It's kind of the fight or flight. When you're outside, you're so stressed and you have this heightened awareness and your safety is in a jeopardy all the time. But when you come inside, whether it's to a place like this or even a home, we see that those symptoms become manifest now because the stress is wiped away, you're able to relax, and the sickness that has been there for a long time comes to the surface. And so this has given us the opportunity to not only do that, but then intervene so we can help them get better and move along the path that's going to be the best for them.
Well, thank you so much. Heidi Marston, Interim Executive Director for LAHSA. Thank you for everything that you do. And I know your people work really hard
They
out
do.
there.
They're amazing.
Amazing
Yes.
people.
Yes.
And thank you for joining us for this edition of LA Currents. I'm Saida Fagan.